Hello, people. It's Pimo. Hi, people. Welcome. This is Conversations with Pimo. Like clockwork. Uh, it's 6 o'clock, Wednesday evening. Where would you rather be? Live on BR with Pimo. Yes. Live on BR with Pimo. 6 o'clock. You're welcome, people. All right. Let's start tagging our friends. Let's, go and start calling them up on WhatsApp. Send messages to personal messages to your friends. Slide into their DM and tell them Pimo is life. Pimo is life. I am life. Yes, 6 o'clock. This Wednesday, it has been such an amazing journey the past few weeks. And I'm just loving it. Guys, it gets better. I'm telling you, by the day, it keeps getting better. Hot, juicy topic. Last week, we dealt with irreconcilable differences. And I tell you, till today, I'm still getting, comments about it. With respect to how people were thoroughly blessed by that interview. It was amazing having the amazing Pastor Mrs. that joined us for that conversation. Hi, people. This is Pimo. Hello, Nilola. You are welcome. Good evening. Good evening, people. We're about to dive in to talk about mental health, one topic that is so dear to my heart, and it's amazing that a number of people shy away from it. So let's get the numbers rolling up. Guys, go and tag your friends. If you can see and hear me, as always, do a thumbs up. Do a thumbs up. Let me see you. Let me hear you. Rather, let me see you. If you can hear me clearly, I believe you can. Welcome, Aboyede. All right, not a problem. I'll do that. Welcome, people. Is it because we're not talking relationship now? People, where am I? Where are they? My consistent and loyal audience. Where are they? Awesome evening, and possibly morning stroke afternoon in some places. You are welcome, everyone. You're welcome. Good evening, Evelyn. Dagana. I like your surname. Dagana. Good evening. You're welcome. Okumagba. Anna, you're welcome. Good evening. Ayomide. Good evening, guys. Good evening, everyone. This is Pimo, and this is Conversations with Pimo. And today we have such a hot topic, and I'm really looking forward to having this conversation because my speaker is such an amazing woman, amazing young woman. Adunke, thank you. God bless you. Thank you. You're welcome. Ojo Lakpe, you're welcome. Lakpe, thanks for joining in. You're welcome. All right, people, let's do this. Tag your friends, share it in your zones, share the link. I would have said do a watch party, but you can't because it's a closed group. So you can't do that. All right, people, let's make this. Let's spread the news. Let people know that we're about to roll. We're about to start. Awesome. Conversations with Pimo. And like I said, this evening, Wednesday, beautiful Wednesday evening, we're going to be looking at mental health. We're going to be looking at mental health, particularly drilling in on personality disorders. Personality disorders. I mean, honestly, you wonder why some people behave the way they behave. We need to learn about these things. You wonder why you behave the way you behave. You wonder why you switch moods. You wonder why you find it difficult to trust. You wonder why you find it difficult to forgive. Honestly, there are certain things that can be explained. So it's not everything that is spiritual. Good evening, Gloria. Oh, thank you. God bless you. Thank you for that compliment. Good evening. Good evening. You're all welcome. You're all welcome. I'm particularly particular if that English is correct, about this topic, and it's because of the environment we found ourselves in Nigeria and Africa, where we shy away from these things. When people hear mental health, they think we're talking about someone that is mad, or they think that it's about discussing certain illness or ailment. No, people, no, we are changing the narratives. We need to talk about these things. Too many women suffering depression, silent depression. Too many women going through difficult times, even in their marriages. We all heard about the statistics, how it went up during COVID of marital issues and divorce this COVID season. We all saw it now. It was all over the social media. So some men are behaving the way they are behaving because it's a personality disorder. But because in Africa, we have been so used to, labeling everything as spiritual. Say, one sheni lati family. Who says so? Who said they are shaming her from her family? Or they are shaming him? And which I think, that, like they say in Africa, in Nigeria, when we cannot explain something, we quickly just, attribute it to spiritual issues. We just say, it's the people from the village. Sometimes it's not from the village. The village is right there inside that person that is making that person behave that way. I often say something jokingly that there are a number of things that we blame the devil for, that when we get to heaven, even the devil himself will say, I did not know about this thing. Oh, it's not me. Oh, Emika, it's not me. Even the devil will say it's not me. And for the first time, he's probably not lying. That is not him. Good evening, Violet. Yes, so they will say his village people are after him. They are the ones doing him. But sometimes we just need to talk about these things. And I was reading something this morning about rape. When the person was, talking about how we need to break the stigma around rape victims. And that's why you find that when there's a rape case, the victim and the family try to cover it up, not because they like what has happened to them or to their child or to their daughter or to their son, but just because they don't want to associate themselves with the shame. And you ask yourself, who should be ashamed? The victim or the person, the perpetrator? Who should be ashamed? Thank you, babes Adunki. Tag all of them. Tag your friends. This is a discussion that we shouldn't shy away from. We shouldn't shy away from it. You hear that someone is suicidal and you wonder how. Personality disorders that wasn't checked. And can we find solutions to this thing? Yes. But the way to find solution is to firstly even acknowledge that there's a problem. That there's a problem somewhere. Honestly, that there's a problem somewhere. Oh, the Lord will help us. And so that's why today, we have an amazing babes who is a professional. I've shared her bio with us on the group earlier today. And amazingly, she also has a Facebook page where she deals with these things. And it's right there. She even gave us a free mental status assessment so that you can see. It's amazing how we take care of our bodies when we have malaria or typhoid or anything. We take care of our social life. We take care of what else? We take care of our bodies. We take care of our spiritual life. But then we pay little or no attention to our mental health. Little or no attention. You know, a number of people fall into depression without them even knowing. But it's gradual. It doesn't just come on you. It's gradual. So let's tag, keep tagging your friends. This is awesome. Tag your friends. Let's sit down at the feet of the professional and hear and learn. And if need be also, you know, take lessons and possibly seek private counsel. I believe that at the end of the day, our guest speaker would be willing, you know, to offer her services at, you know, at a reasonable fee. To just sit down and talk to. Sometimes all you need is just sit down and talk. Talk to a therapist. You know, when people say they need to see a therapist, we quickly label them and make it look like, especially in Christendom. See, let me talk to you, my sisters. There are too many things that we spiritualize. That God has provided a way out for us. But we over spiritualize it. Meanwhile, you are there dying in depression, dying in a lot of things that you don't have answers for. And then you feel, let me just quote a few scriptures. No. You can't pay lip service to God. You can't just quote scriptures to cover it. No. At all, you can't do that. You actually have to tell yourself that I need to deal with this thing, and if I need to sit with a counselor, if I need to sit with a therapist, it's okay. It doesn't mean that you've gone mad. It doesn't mean that there's something wrong with you up there. It might just mean that you need to speak with a professional, and then you will notice they will now begin to ask you questions, some things that you probably didn't even consider. It will begin to pop up. So yeah, without taking too much time, like I said, I'm not a professional in that area. I'm just passionate about it. And my job, my duty, and that's why it's Conversations with Pimo, is to talk about these things. It's real life, real issues, real people. Let's deal with these things. The things that need praying for, we pray. The things that God has provided a way out for, we take advantage of it. We take advantage of it. We don't sugarcoat it and make it look like, oh, it's one of those things. No. And we're still going to come to it. There's also the one of children. Remember a post that I put up here, a video about a girl that murdered her own daughter, drowned her. And I could read through the comments and I saw people saying all manner of things. From the interview, I could deduce that the girl had issues. She had issues. She's been deprived of love. She's unforgiving, firstly of herself. And so this is her mental state was warped. She needed help. It was a cry for help, not a cry for judgment or a cry for people to come at her. A lot of people around us, at work, at home, are suffering. They're going through things. Do you know an average Nigerian? You know, it sounds very, very, very funny. There was a video I saw. A friend posted it. A white kid got stuck in a bucket. You know, sat in the bucket and got stuck in a store. And of course, the mother was trying to help and then called for help, and they helped the boy out. And then they showed another clip of a Nigerian parent sweeping. And then the child entered buckets and got stuck. Do you know what the Nigerian parent did? She went to look for cane and started beating the child till the child came out of that bucket. And you know, the caption was, same problem, different approach, same result. And I looked at it. I said, yeah, it might look like same result, but the process has done something to that child. How many of us here, Nigerians, can actually say that you grew up with your father and your mother loving you, hugging you, telling you that they love you? How many of us grew up hearing that? How many of us grew up, you know, hearing that? I was listening to a pastor recently, and he was sharing his experience of how growing up, he never really had, you know, this whole mother tell you I love you, father hugging you and all of that we see in the movies and everything like that. And he didn't grow up, you know, having that kind of experience. And so when he got married, he had issues with touching. Whenever his wife touched him, you know, maybe a way of showing affection, touched his chin or his head, he felt like, don't touch me. Now, if he didn't deal with that issue, it would have become a big issue in his marriage. But thank God, he quickly dealt with it, sought counsel, and he was able to, you know, trace it down to how he was brought up. I'm telling you, you know, there was a particular experiment that was done about children. I don't know how far this is true, but I heard that an experiment was done. They brought babies, and they had some in a ward. Nobody carried them. They made sure they didn't experience human touch, you know, and all of that, limited human touch. And then on the other side, they had these babies. They were being cuddled. They were being touched. They were being this. I can't remember the outcome of that experiment, but one child didn't. The set that was devoid of touching and loving didn't grow up well. I'm telling you. Honestly. I'm telling you, Favor. She had mental issues. We need to be, and that's why we're creating this awareness to change the narrative. We need to change the narrative, people. And it starts with us. It starts with us. When a friend comes to tell you something, do you say, go for deliverance, oh? Or do you think about it and say, why don't you speak with a counselor? Why don't you? I'm telling you, it's not shown. It's not given any priority in Nigeria. I agree with you, Grace. A lot of people in marriages, low self-esteem. You see someone just withdraws. You see someone, you've known her in university, very vibrant, very, you know, exciting young lady. She gets married, and then before you know it, she's very withdrawn. She speaks little or no words. Or somebody that you used to know, very active, vibrant on social media, and all of a sudden, they crawl into a shell. There's something wrong. There's something going on. Can we be our brother's keeper? Can we look out for one another? Honestly, mental health, we need to create the awareness. We need to push it. We need to raise it there, raise the bar, and let people know that we can talk about these things. People can seek help. People can cry out for help. People can say, I'm here. I need you. I need to talk to someone. There's just a lot of pressure. Societal pressure. The pressure to make it. The pressure to feel among. The pressure for some people, you're like, what's the big deal? What? You know, some ladies who jump from one guy to the other, being used by one guy from another, you know, it's a personality disorder. And here you are saying, what's wrong with you? Can't you just keep yourself? Can't you behave yourself? Sometimes they really cannot help themselves. They feel so helpless. Honestly. So many women are suffering, Komi, I tell you, Anna. Suffering. And they need help, honestly. It's being preached to on the pulpit. I agree with you, Adeto. I am an advocate for it. I'm an advocate for it. And I am one of those pastors that would encourage it. Have a mental health person talk about it right there in church on a Sunday morning. I'm one of such people. Because we cannot shine. You know, church, everybody comes looking all fine and everything and all of that and all that. But men, they are dealing with issues. Okay, so let me clear the road for the professional so that I don't take too much of our time. Like I said, she's an amazing young woman. She's based in the US. She's a professional. She's a psychiatric nurse. And one of the things she's passionate about of late is just training people, going out, talking rather, congregation, talking to groups of people, talking to leaders, and just letting them understand the importance of mental health. And so we're going to be hearing from her, this afternoon. And where are you, my darling? I can't find you here. Babes Oluwadayo, can you please send me an invite so I can bring you on board and we can just, hit it on and just have a great time. So yeah, guys, we need to change the narrative. We need to talk about this. We need to stop the labeling. We need to stop it. It's not everyone that is envious of someone on social media. It's just their mental health. They are being pressured. They open social media and all they see is other people's achievements, and you wonder, why can't you celebrate them? And it's not that they don't want to celebrate them, but it's just affecting them because it's not that they're not happy for that other person, but it's making them feel like they're inadequate, they're not significant enough. All right, Oluwadayo. Okay, I can see you now. It's rolling. Let's get this rolling. Yes. Many keep quiet. Hi, Oluwadayo.
Hi.
Hi, how are you?
Well,
good to see you. What's happening? I can see you and I can hear you.
Okay, that's good. But I want to start by just letting you know that there are really some of you so-called leaders that you you have a lot of people following you, and I really don't see any impact that you're making or whatever you're doing. You use all this platform to just get people there and just impose yourself on people and impose what you have on people. And
okay,
you brought me live today. That's okay, but it's an opportunity for me to tell your people that, well, maybe they need to look outside and make sure they're getting their information right before they just believe what you so-called leaders say and talk about. So you might be surprised that, okay, what is she talking about? But I know what I'm saying, and I have the opportunity to say this, and so many people will hear this. So just know that this is an opportunity for me to let the people following you know that they need to get their information right before they just follow people like you.
Okay.
So.
Okay.
You are shocked.
I am, because I honestly am. Maybe I'm not getting you clearly. Could you please explain?
Okay. Well, I'm sure by now a lot of people will be, wondering, who is this person that she brought on, and we don't even get what she's saying. But I know what I'm saying.
Okay.
Okay. So all those things that I said when I started,
yeah,
you're already thinking what's going on here. You're already processing. Who are you?
You caught me off guard. And I'm like, we still had a conversation some other time. What's happening here? What have I done? You caught me off guard. For a minute, I was like, okay. I started thinking in my head, okay, so I'm listening, yeah.
That is a demonstration of how our brain is working every second.
Wow.
What I said. And you can see that somebody's already saying, who are you? And what are you saying?
Oh my God. Oh my God.
In that moment, I'm sure you've thought of so many things. I'm sure people looking like, wait, I thought she brought in a mental health professional. I think this is actually somebody that should be in the hospital. I'm sure so many people are confused. So many people are confused. And really, that is a demonstration of how our brain is at work every second.
Wow.
So the way you reacted to what I said, some other person will probably have hung up to think, hey, this is an embarrassment. Some other people would have said, okay, what did you say? Like Babes Jones is saying, okay, who are you? What are you saying? There's so many people, some people are already tagging other people that, okay, oh, it's about to happen today. You guys come and but
Right.
everybody's reaction and everybody's behavior or what they would do next after hearing what I'm saying is based on so many things.
Wow.
You are a leader. See how you paused and you're like, okay, can you tell me more? I don't understand what you are saying. You know, all the things you're saying based on your Christian background, based on your leadership position. I'm sure you've resolved so many conflicts. I'm sure you don't. So you're like, before I say anything or hang up, let me understand what she's saying.
Right.
And some people are already looking at me like, this must be a spoiled brat. What is she saying? Is she mad?
Oh my goodness. And your expression didn't even give you, as in, you were, for a split second, I was like, okay, what's going on here? Wow, go on, I'm listening.
That is our brain at work every time. When your husband says something, when my children are doing something, the way I'm interpreting and seeing things, the way I'm responding, the way I'm processing it, even when I'm not talking, the thoughts in my head, all those things are what the brain is doing every time.
Wow.
Every time that we are awake, our brain is at work. Unfortunately, we ignore the brain a lot. Unfortunately, we pay attention to so many other things that are on so many other parts of our body other than the brain. That thing that just happened right now, it could be that I'm actually in distress. It could be for so many reasons, but it's just to demonstrate that every second, everything that we're looking at, hearing, seeing, is our brain is working on it.
Yeah.
So with every mental health awareness program or any time that I speak, I like to start with the first thing first. Mental health is not the same as mental illness.
Okay.
Mental health is not the same as mental disorders. Mental health is just one thing, the healthiness, the wellness of our brain.
Wow.
So our reaction, our behaviors, our thoughts, and our feelings, all those things are controlled by different parts of our body based on different hormones we have in our different neurotransmitters we have in our brain. So just as we have blood flowing in our body, we also have neurotransmitters in our brain that are working, and some of them, sometimes when they're low or when they're high, it's determining how we're feeling. We're talking about hormones, we're talking about depression, we're talking about so many things. And sometimes it's the way the brain is formed right from the time the child is pregnant. Sometimes it's the genetic factors that we do not have control over. Sometimes it is our life experiences. The way you handle that drama now has a lot to show with you are a leader, you've encountered this kind of thing before. This is coming as a shock, but you are quickly asking the right question. Can you tell me more? I don't get what you're saying. Okay. So now that's the first thing first. Mental health is not the same as mental illness.
Mental illness.
Are there people, so when we talk about physical health, it's not the same as a disease in our body.
That's right.
All the people that have diseases in their body, hypertension, diabetes, cancer, hypothyroidism, fracture, malaria, any of those things, does that make them less of a human being because they have a disorder? Or because they have the same goes for anybody that has any mental illness. So when we understand that, we understand that this is just mental illnesses are just a deviation from normal or something wrong with a part of the body, and it can be treated.
Okay.
And just as you go to a gynecologist for something that has to do with your reproductive system, and you will go to an orthopedic specialist as anything that has to do with fracture, it's the same way they just give people that are dealing with brain illnesses, psychiatric issues.
Right.
So the people that are seeing us are not less of human beings. It's just taking care of a part of their body. First thing first. So anybody that will listen to this or get this or hear this, I want them to understand that first.
Yeah.
That way, we will start seeing that mental health is everybody's business.
Business. Right. I agree
You need to take
totally.
care of your hair. You look so good. I like how your hair is dropping. You're wearing glasses because for some reason at some point you've seen the need to help your eyes instead of straining it, and then you're wearing glasses. And it's okay. So it's the same way that all of us, now please note this, everybody listening, all of us, right from pregnancy stage to
Mm.
our old age, mental health is important.
Mm. All
Everybody.
right.
Right from the time a woman is pregnant, the stress that the woman is going through or not during pregnancy, the care
Yeah.
that the child gets or not during infancy, as the child becomes a toddler and the experiences they're having, the trauma they're seeing, or the care and love they're getting as a toddler or during their childhood phase, as they're growing up and going to school and having relationships and dealing with people and stuff like that, all these things, up until they get to university or for those that go and learn a trade or do any other thing, as we are growing every phase of our lives, the experiences we're having is influencing our mental health.
Wow.
Therefore, we have to, everybody, and we need to know this. It is not only for women, it's not only for men, it is
Man,
not
that's
only
right.
for children, it's not only for adolescents, it's not only
Yeah.
for other people, even our parents, our elderly people. So from the time a
Yeah.
woman conceives till the time they become grandmas or grandpas or they're nearing their late stage in life, we all need to take care of our brain, our
Man.
mental health.
Hmm. All right.
Yes.
Awesome.
So all that said, while I was talking, I noted some things that affect the factors that affect our mental health. And these are the things that when there's a mental illness, we don't really have causes for them. We're referring or looking at the risk factors. There are these things that
Okay.
are affecting us that we need to take care of for mental healthiness. They are the same risk factors that when something is wrong with, we're looking at for when there's a mental illness.
Okay.
These factors are there are four major ones.
Right.
One, genetic or biological factors.
Okay.
Just the way that somebody will look at you, I don't know, how many siblings you have, and supposed to say, how do you look? Why do you look like your daddy like this? You're just the carbon copy of your father. Look at you,
Yeah.
or your mom, or hey, you look so much like our uncle or our aunties. The same way we're seeing these physical manifestations, we have the genes and some other things in us that we're taking after people, our parents, or taking from our relatives that we do not have control over. So if they
Mm.
have something, we are likely to have it too,
Mm.
or not. We have the
Yeah.
risk factors.
Yeah.
Another thing is biological factor, and that is why when a child is developing in the womb of the mom, that stage is a very precious stage for every woman. Not just because they should eat well, not just for safe delivery, but because a child is developing. And
Yeah.
sometimes we have some children that they would have some brain malformation or they will have some
Yeah.
imbalances and stuff. So
Yeah.
when we have a child, we see this child is not meeting the developmental milestones or the
Mm.
child is not doing this and that. So that's a biological factor. We don't really have control over it. So when that
Right.
happens, if we know about mental health, we're able to intervene early for that child.
Early. That's right. That's right.
That's where early intervention comes to place. That's why our teachers need to know about mental health. That's why in healthcare facilities we need to know so that we can check this thing early. And if the
Right.
environment, the culture, the religion, the people, the family would not keep stigmatizing, it would then be easy for parents to seek out help for their children at that
That's
age.
right. That's
And
right.
there's some we're growing other than the biological and genetic factor, which we usually don't have control over, but we now also have life experiences, past
Okay.
experiences, childhood experiences. The
Wow.
childhood phase just like when the child is developing in the womb, the childhood phase is a time that the brain is really maturing. They are taking, just like people say, catch them young, catch them
Yeah.
young.
Yeah. Yeah.
It's not only for academical reasons, it's only
Yeah.
even the brain is forming. We know that the things that they learn early becomes easy for them. We know that the
Right.
languages that they hear early and they pick up, it's easy
Yeah.
for them than when they grow up more and you're trying to teach them. Even for us, that is why that stage of life is very precious for every
Right.
child. So a child
Mm.
that is exposed to tender, loving care from parents in a
Right.
protected environment, you cannot compare the child to someone who grew up in the
Yeah.
war zone, or someone
That's
whose
right.
parents were having conflict every time, or someone who grew up in a child where there's addiction or substance
Yeah.
misuse, or where the
Yeah.
child is actually being abused or violated.
Right. Right.
Childhood experience is very important as well. It's one of those factors. Other than
Okay.
that, we say past experiences. For example, even if one is in college or something and you experience something like a rape or robbery,
Right.
or
Yeah.
you experience a gunshot, or you're exposed to something bad,
Yeah.
it can also affect you. Like the
Yeah.
example you described of somebody touching someone.
Yeah.
So
Yeah.
that that's another factor. And then we
Exactly.
now have another factor of childhood. If I like the way babes Tanika Jones is helping me to kind of
Yeah.
reframe all this.
She's really
Thank you.
following, and she was the one that was asking you, what are you saying at the
Exactly that
beginning?
was. Yeah.
Oh my God.
So,
Yeah.
so that is another factor. We've said two now. We've said biological, genetic factors, childhood experiences or past experiences. We also have lifestyle. We have
Okay.
lifestyle, those that are not, caring for themselves, those that are taking alcohol, risky behaviors,
Yeah.
exposing
Yeah.
themselves to different things. We also have that. Another
Yeah.
one is if there's a history of mental illness in the family, there's a likelihood of somebody having it.
Right.
Other issues are like stressors. Other issues are like, what religion or the cultural background,
Okay.
all this sort of things
Okay.
affect it. So
Okay.
that's it about, so these are the things we need to really watch for mental health on a, systemic level, so that
Right.
we're helping children, we're helping pregnant women, we're helping our elderly people, somebody
Mm.
whose children died, or somebody who lost a spouse, or somebody who experienced
Right.
domestic abuse. When they grow older, they're thinking about all these things. They're depressed. They're because they
Yeah.
have a
Yeah.
fulfilling life. They're
Does it
regretting.
ever really leave our minds? Does it ever really leave us?
No, they don't ever really leave, but we can build or develop a good coping mechanism.
Oh,
Or
okay.
even if they
Okay.
remember it, because you know that there's some people who are, for example, I'm saying rape because of the population, our
Yeah.
audience.
Yeah.
For those
Yeah.
who have experienced that, you'll see that some people, they are coming out talking about it and helping other
Right.
women. If you
Right.
tell them that when they're telling their stories, they can tell you the time, the date, the smell,
Right.
the almost
Right.
everything they can remember vividly. It doesn't leave them.
Right.
However, they are helping other people. They are not still brooding. They are not still feeling that low self-esteem.
Mm.
They are not feeling,
Okay.
so we can, but the healing has to come by opening up and talking about it.
Okay.
So
Okay.
there are so many disorders, there are so many issues, and thank you. You already mentioned a lot of them, and we have to really pay attention to those things. But you really want us to focus on personality disorders today. But I had
Right.
to just give it that foundation because
Yeah.
we'll keep talking about
Yeah.
them now.
Yeah.
So uh, personality disorders is one of those mental, the group of mental disorders. We call them personality disorders because they are depressive disorders, anxiety disorders, bipolar disorders, trauma-induced disorders. There are so many other major categories, but we're focusing on personality disorders. And in our DSM-5, our Diagnostic and Statistical Manual for Mental Health Disorders, which we use here, we also have the ICD-10, which the World Health Organization has, and they use it in other countries. But I will
Right.
use the DSM, the fifth edition. There are 10 of them. There are 10 personality disorders. Ladies, please
Wow.
listen to me. please tag people, please share this. I mean, call people to come listen to this, because I want to start by, why should we know about it? We should know about it because even though a lot of other mental health disorders affect people around us, the ones that are these personality disorders are one of those that directly affect the people around us. It directly affect the people around us. As a matter of fact,
that's right.
People with personality disorders don't even know, because they are set in their, a lot of times it's the people around them that are bearing the brunt of it.
That it affects. That's right.
And that's why it's one of the ones that we really focused on in our the group, because mental health issues, for those that have psychiatric disorders and they're taking care of it, it's already, they know, they diagnose, it's known, they know and they're treating it. However, the ones that people outside suffer from, and the person that is having it does not even realize they're having the issues, their personality disorders.
Exactly. Exactly.
It is significantly affecting relationships.
Wow.
There are 10.
Yeah.
They are divided into 3.
Okay.
The first group, we call them cluster A, B, C. The first cluster, and they are in clusters because they have a kind of like, it's just like you're in a big compound.
Similarities.
And you have, they have similarities where we can put them together.
Right.
The first one, cluster A, they are the odd ones, or like the eccentric ones. We call them the odd and eccentric because the way they're behaving is kind of, it's like really odd and awkward. And these ones are paranoid personality disorders. They are the schizoid personality disorders and the schizotypal personality disorders. They are odd and eccentric. Those ones are there. The second group, these are the dramatic emotional group.
Wow.
Yes. This one, they are the narcissistic personality disorder. They are the histrionic personality disorder. They are the obsessive compulsive personality disorder. Histrionic, narcissistic personality disorders, borderline personality disorders, and antisocial personality disorders.
Wow. Wow.
Cluster B, dramatic, extremely emotional. The third group, this group, they are the anxious and fearful. These ones are the avoidant personality disorders, dependent personality disorders, and the obsessive compulsive personality disorders.
Wow.
There are 10 major ones, and then we have the ones classified as orders. For the purpose of this group and the time limit we have, I'm going to focus on four that are common and prevalent among women, and that we can easily relate to. And then I would encourage that, if you haven't joined the group, because in the group every weekend we picked one and we dissected it, you will learn a lot. So we're knowing about these personality disorders to know that because they impact relationships, for you to be able to take care of yourself, at least when you know you are not really, killing yourself. And
that's
then number
right.
3, so we can help people around.
Can identify and help people around.
Exactly. So now let's go into the 4. You see,
sorry, Oluwadayo, before you go into the 4, I just want you to talk, to just address this. There's this thing I've heard that a child's personality is formed at certain age. Is that medically correct?
Okay, so we all have traits, right? We all have personality traits that we pick up from things. And in fact, thank you for asking that question, because, okay, it will make me go into this. Personality disorders is like a way of life, a pattern of behavior that is rigid, maladaptive, and that is affecting us in every area of life. They usually start at early adulthood. Okay. So when the child is growing on, remember we said the things that they learn, the things that happen to them is already building, what they're having. So that young age is a very crucial age that whatever happens at that time can go ahead through lifetime.
That's right. Okay.
So we all have traits. Like you know, you might be nice now to everybody in the group, or maybe I'm just always nice when I'm on a show and doing all that. But I might actually be, you know, very distant and stuff when it comes to maybe my family members or maybe my employees and stuff like that. That still does
Right.
not put me. That's just my trait. And maybe if somebody call my attention to it or something, I'll say, okay, well, because there's so many traits and things that when we get into relationship, we change based
Right.
on, okay, maybe your spouse told you they don't like it or stuff. Even though it's your personality, you know, you are still flexible and able to adjust. But
Yeah.
with these people with personality disorders, they, because of things that have happened, and you will see, because most of these things is as a result of childhood
Exactly.
experiences,
Yeah.
parenting style,
Yeah.
yes, and the things that they're exposed to for a long
Environment.
time.
That's right.
Yes. So the way they're now trying to cope or adjust to that
Mm.
or protect themselves is what is now manifesting. And for personality disorders, it is not just in one setting. It is
That's right.
happening with relationships at home. It is happening in
Okay.
school. It is happening at
Okay.
work. And
Right.
it is a long-standing pattern that is
Pattern.
inflexible.
Wow. Wow. All right. Awesome. I totally got that. I totally got that. So before we can consider it a disorder, it's long-standing. It's a
It is
long-standing
long-standing.
pattern. It has formed a pattern. So it's not like someone is just moody today and then we say the person has a personality. So it's something that has happened over time, over a period of time, and has formed a pattern, right? That's when we can say it's a disorder. Awesome. Okay, I'm learning.
And another thing is that we should be enlightened enough to know not to label people.
That's
These are
right.
diagnoses that had to be made after so many other things have been eliminated. And
That's
that is
right.
why we need more people in mental health profession. We need more people to support their people to seek help, even though it's very difficult with personality disorders.
I
But at
know. I
least
know.
we'll be able to protect ourselves when we know what is going on, instead of,
You were
causing more trouble.
I saw a question you put up on your group and you were asking, would you let your son or would you let your child read become a psychiatrist? You know, and
Yes,
I don't think I read the comment, but I could almost imagine the comments here in Nigeria that an average Nigerian parent would be like, "Hey, you know, because of the whole, you know, idea wrapped around it." But I really agree with you that more people need to go into that, you know, to help
yes.
a lot of people.
Yes. Let me share this personal experience with you. You know, when I was, growing up, even though I really like talking to people, I like to help people out. I was actually like a nurse, the health prefect since I was in secondary school
Oh,
and stuff like
wow.
so. Anything hospital, I've always been doing it. But I was thinking, okay, when I special because my father would not let me rest until you go. He's the type that they empower their female children
Yeah.
to be
Yeah.
their best, you know. So he really wanted to build the self-esteem, and he keeps saying, now you finish your school, what will you do? I was thinking, what would I do? There was really nothing else, and I'm
Mm.
not honestly not cut out for hospital setting. I'm more of, let's go to the community and get people where they
Okay.
are, so that we
Okay.
prevent more people from going to the hospital. So I was
Wow.
thinking, what would I do? But in my head, psychiatry is the closest to my nature, what I really
Mm.
want. However, I have the fear that because when I went for my psych rotation in neuropsychiatric hospital in Abeokuta, popularly known as Arrow. There
Arrow.
was one of the nurses that we saw that had like a on injury, on the job injury, and she's not deformed. So I had this fear. In fact, when we were going to Arrow, we were scared. It's almost like everybody. It's almost like when these people, when they open the door like this, they will pounce on us. And
Wow.
really, and even as a nurse, but when I started hearing this, what the fear of the danger that comes with dealing with violent patients, which is all that we always think mental health is, really prevented me from going further. So at some
Mm.
point, when I now had a depressive phase personally,
Wow. Wow.
That was the moment, and I was almost drying away in the room. You wake up and you're not happy to see another day. You wake up
Wow.
and you're like, why do I even exist? It's almost like your world is gone. And you are just like in that cave alone. You don't have anybody to see you. And there was one day I was like, it just occurred to me, wait a minute, is this what depression is? Is this what they're
Wow.
calling? And it was then having that first-hand experience that gave me this, like, how many people like me, professionals, I was a professional, how many professionals like me, how many women like me, how many people from my background know nothing about mental health and we're dying away. Or
Wow.
I do not even, for the fear of just my myopic reasoning and knowledge of what psychiatry is, and I'm not going to do this again. And I'm not going to do it because I don't want someone to hurt me. Anyway, that was when it was from that experience that I was able to decide this is what I'm going to do. I am
Wow.
going to let people know. And guess what? My experience came from the insensitivity of my leaders at my workplace. And
Wow.
it's almost like you put everything there. So my focus, if you see my focus being on true, leaders can
Yeah.
make a change, a
Yeah.
great change,
Yeah.
like doing like
Yeah.
you're doing now. But the other thing is that this is coming from my personal life experience and me knowing the real life impact of what
Mm.
lead. If I did not get out of it, it could have led to suicide. It could have led to other things because I was already thinking there's no purpose for me. The kids were there. I
Wow.
couldn't even cook for them. There was no value for anything. I was just
Wow.
in bed. And from that, I'm like, I'm going to do this. So anybody that is considering it, or anybody that the children or a niece or nephew is considering it, if they really have passion for engaging people, helping people out, if it's going
Yeah.
to be psychotherapy,
Yeah.
if it's going to be anything, let's encourage them because we need more people.
That's right.
The last
That's right.
the last the last data that I found in Nigeria, at least for psychiatrists, even though we have so many other professionals taking healthcare, mental health professionals, but the prescribers, the last data that I read, anybody should tell me if there's a new data, is like we have 300 psychiatrists to over 200 population of Nigerians.
Wow.
And yes, they even have less in Ghana because I deal with a lot of African countries and
Yeah.
leadership. We have of mental health professionals, but we need more.
Wow.
But before that
300 in the
time,
whole of Nigeria.
yes, the last statistics that I checked. So it may be something, maybe another thing is out. The last that I checked,
Wow.
that's just
Wow.
prescribers. I don't know about the mental health nurses. I don't know about the
Right. Right.
psychologists, but that's the one that I got. So we need more people to help us. But pending that time,
Yeah.
people like you and I, people like everybody watching us right now, we can make a change with
That's
our
right.
power
Yeah.
of one to help
Yeah.
ourselves. I always start with self. To help
Yeah.
ourselves, look inward, make sure you're fine. Before
Yeah.
we start labeling our friends and our in-laws and our everybody, start with self. And then we're
Yourself.
able to help our family members. And then everywhere that we find ourselves at work, in the community, in a larger family group, even on Facebook groups, everywhere we
Right.
find ourselves, we can be
Right.
ambassadors to make it easy for people to seek mental health care.
That's right. That's right. Totally agree with you. Totally.
Yes. So now let me go into the four
That's
that
right.
are common to us. Oh, well, sorry. Before I go into that, I want people to know that obsessive compulsive personality disorder is different from obsessive compulsive disorder. So they're
Okay.
not the same.
All right.
People think OCD, OCD, I'm OCD, I'm OCD, that everything has to be clean. I'm OCD. That is not the same as having obsessive personality disorder, obsessive compulsive personality disorder. Please join the
Wow.
group. There's one whole video on that, but I don't want all of us. OCD is under anxiety disorders. That's for
Okay.
another day. Just clearing the air. Don't
Yeah.
take the same. The second thing I want to change is that antisocial personality disorder is not about people who are not sociable.
Okay.
Antisocial personality disorder is Antisocial personality disorder is not people who don't like going to parties. It's not
Right.
introvert.
I
As
would
a
have
matter
thought
of
that's
fact,
what he meant.
no, no,
Okay.
it's not. So we need to know more so that we can help, and most
Right.
importantly, we can stop labeling people.
Right.
And then, with social personality disorder, as a matter of fact, they are very charming people. You see them for the first time, and they're charming, they can attract you, they can do all this, but they're the ones that would be in trouble with the law. They will have trouble with policemen. They are always arrested.
Wow.
They can shoot people, they can do stuff. It's a very,
Wow.
it's not, it's not a very healthy one, even for people around them. So we need to know
Wow.
more. So just
Yeah.
clearing air on those two, because
Yeah.
people easily interpret them.
I'm
Yeah.
going to tag your Facebook page on our wall.
It's a group.
DR has a few walls, like few groups like that we are kind
Okay.
of in partnership with. So it's right there on our wall. So I'm going to do that for your group. I'll tag it as one of the groups that people can connect with and just and just be a part of, because I've been there a few times, and I will tell you that I have actually learned a lot. The few times I've been there, I have learned a lot. So yeah, thank you so much.
Thank you. Thank you so much. So, and I will say something to what you just said before, when we're about to close. So,
Okay.
yeah, so these four. Now let's go into the four that are common. I know people are very familiar with narcissistic personality disorders, and they're always saying that, the husband, that husband, my husband. They are very, as a matter of fact, I got a lot of comments about narcissistic personality disorders that women were saying what they're going through, and their husbands met the criteria, because we have criteria that somebody must meet, different
Yeah.
traits. Some are up to 5, some are up to this before we can diagnose them with it. So everybody knows that, but even with that, it's not everybody that has the disorder, and people
That's right.
misinterpret it. So that's one. Now, the ones that I want to say, I will take from the dramatic group and for
Okay.
the fearful group. The first two from the dramatic group cluster B that I'll talk about is borderline personality disorders.
Okay.
Borderline personality disorder and histrionic personality disorders. Please follow me. People
Yeah.
with borderline personality disorders, they have issues with self-image. They have issues with managing their emotions. They have a pattern of unstable relationship. People with
Wow.
borderline personality disorders, even though everybody say, okay, they can go from 0 to 100 in a short while, and they come back to 0. They are
Wow.
very emotionally unstable. A lot of research goes into this. There's no one cause of it, but child abuse is one of the things that we relate to this a lot, where a child
Wow.
is growing and exposed to a lot of abuse growing up, either from parents, either from environment that they live, and all the while they're just trying to like protect themselves. So every
Right.
little thing you say, they don't have self-confidence. They are very impulsive in their behavior, very impulsive. So they can get angry and destroy something. They can be reckless. They can be reckless with sexual behavior. They can go
Wow.
binging. They can go gambling. This is one of those. They can do anything. They have very fragile self-image. They have a sense of emptiness. They look at
Wow.
themselves and they don't mean anything. Borderline personality disorder are the people that today they just want to have red hair. Maybe that will be their identity. They are the ones that would sometimes just look within themselves and say, who am I really?
Wow.
And sometimes, because of the pain that they have internally, they sometimes do self-harm. They cut themselves. They're trying to get the pain out.
Wow.
When they are angry, they are so intense. They have this intense feeling of they fear abandonment from friends. So any little thing they pick up on you, like,
Wow.
where are you going to?
Wow.
What is wrong with you? They go, they go, and you're like, what is it? I'm just leaving,
What
because
is
they
happening?
have yes, they have issues with their self-image already. They feel empty. Yes, Jesus can fix that. Jesus can fix that. That's true. But the thing is, people around them are feeling the pain. Family members move
Yeah.
around them like they're walking on shell. You don't know
On
what she would
eggshells.
do now
Yeah.
that that will cause trouble. You don't know what you're going to do now that she would display for all of us now.
Yeah.
Their mood swing is like up and down.
Wow.
But the good news is that this thing can be treated, it can be managed, especially
Wow.
with the self-harm that they do on themselves. If they get a therapist that can help them, it can help them to be able to live. When you talk of mindfulness, we have dialectical behavioral therapy that they can use to help themselves, to help them manage, or at least be able to have a better sense of self, to be able to not,
Self-worth.
to be able to not react every time, because they are reactive, they are very fragile, very
Wow.
fragile. So this thing causes distress for them, but a lot of times the people around them find it
Mm.
extremely difficult to relate with them. So they can't keep relationships. So they're having issues with people around, family members, everybody, and because sometimes when they're angry in their home, they can spoil things. They can
Hmm.
break in before they
Wow.
can hit you on your head when they're in that mood. And
Their
then when they come,
outburst is usually very intense.
that that's the word I'm looking exactly. They have intense anger and outbursts that can hurt people
Wow.
around them. And after that time, when they finish, then they come to their low and
Mm.
they start feeling empty, they start feeling unliked, and then they think people are going to run away from them or leave them. So they are latching on every time,
Wow.
every
Wow.
and yes, it's a very serious disorder. This affects relationship a lot, and it's common among women. Men
Mm.
do have it too, because we have men with outbursts. They do have it too, but this one it's a serious one. And I don't want people to think this is the same thing as bipolar. Bipolar is different.
It's different. Hmm.
Yes, and with bipolar, we have medications that we use for bipolar. The symptoms are different, the criteria are different. So just know that. So
Yeah.
this personality disorder, you see it in people, you might see it in your sister, you might see it in your wives, you might even see that my father was like this, and you see my sister too is almost like my dad. They get angry
Mm.
so soon. Sometimes don't even know what you will
Mm.
say that they will just scatter everything now.
Mm.
Like that. That's
Right.
one. So when you have somebody like this in your life, it's really tense and it's affecting relationship. You see,
Yeah.
this is not somebody with schizophrenia. This is not somebody in the hospital.
No.
These are people
Yeah.
we have in the workplace. These are people we have in our families. These are people we
Yeah.
have in school, everywhere. We have these
Yeah.
people in groups.
Yeah.
They cause trouble even
Yeah.
even even virtual.
Yeah.
They get angry. You wonder what is the matter.
Even in
So
churches.
yes, and it's everywhere. Exactly.
Yeah.
Bipolar is different from borderline. Yes, exactly. So that's one. Another dramatic group. You see that's very dramatic.
Very dramatic. Yeah. Very dramatic.
The other one I want to talk about is histrionic personality disorders.
Hmm. All right.
Histrionic personality disorders. These are people who have excessive need for attention.
Wow.
They are actively, consistently seeking attention everywhere they get to. They could be inappropriately seductive. If you in the
Mm.
group, if you watch the Sally video that had the white sunshades on, that was sitting down like this with glittery dress, that is a histrionic personality. You cannot miss them when they get to an environment. They come in
Wow.
and everybody would have to look at them. They can be
Wow.
very seductive, and they see you. We just met yesterday and they're seeing you. They say, oh Pimo, hello darling, how are you? Oh my dear, how you are thinking? I just said hello to you outside. When did you come? you know they could be very superficial. These people will
Mm.
spend anything just for outward appearance. Are you
Mm.
seeing how this is commonly diagnosed in men? It's more prevalent in women,
In
because
women.
this attention, yes, it
Right.
might. So the contention is that we don't know if it's because more women will seek help, or maybe because more professionals would diagnose them with histrionic personality. But for some reason, this is one of those that have more high prevalence in women, and we can see
Right.
it even around. So
Right.
even if you do not meet the criteria, because like I said, because of time, I'm not naming all the criteria, but even if you don't
Yeah.
meet all the criteria, we have this trait. Some people have this trait, they get everywhere, they are overly seductive. You are trying to drag your husband away. Wait, kilo de gon,
As
you
in,
know. Because yes, at work they can be very sexually inappropriate. They are easily influenced by people, you know, and they talk with so much conviction. That, Pimo, I really like Babes Redefined. I really like Babes Redefined. So I said, okay, tell me what you like about it. Well, they don't know. They probably never even read any post.
wow.
But everywhere they are, they have to get their attention. And they're the ones
Mm.
that when their attention is not on them, they can break table. Or they can just fall down. And you're like,
Dramatic people.
don't we see this in people?
Yeah.
And it's not that they don't mean well. It's not that they don't, but they just have this thing because maybe while they're growing up, they've had a lot of experiences that have made them so suppressed, or a lot of experiences that they've watched people, and that pattern, that's almost the only way they feel recognized. That's their way of of validating themselves. So
Right.
every relationship, they think that it's so much relation. So they have this somebody that they think they're dating, or somebody that they think they're so close. The person is not even that close to them. And then they are so overbearing. They're so
Yeah.
overbearing people
Yeah.
that after a while, people then leave them.
Yeah.
Low
Yeah.
self-esteem is not a disorder. It's not a
No, it's
disorder.
not.
It's just one of the things that can come as as a result of other disorders. But it's something that can be worked on with therapy. If we see
Yeah.
low self-esteem somewhere, we need to. There's something else.
There's a root cause. Yeah.
There's something that's just one of other things. So these are the people with histrionic personality disorders. So, and because they will spend a lot of money on personal appearance, they are the people that we might call, oh, they are so vain, but they need to do stuff. When they say let us wear white, they will wear red, so that when they
Red.
get attention,
That's right.
because you need it for validation. And then you find men, or you find friends, moving away from them. Everywhere you get to is always drama, drama. People don't want to go out with you. People just want you to go on your own, and they go to the party because and sometimes because they're also very sexually inappropriate, even with women, sometimes they're like, what is it? Why are you always like this? And then people start avoiding them. And then people
Wow.
start calling them up. And a lot of times when we find them in therapy is when, maybe they've had, what we call heartbreak, but maybe this person doesn't even have, this person that they're thinking they're so intimate with does not even see the relationship like that. But
That's
it is part
right.
of their own issues to
That's
see
right.
it that way. So the person now calls it off like, hey, just go on your own. Or
Yeah.
maybe the person wants to get intimate with them because at first they're really friendly and personable and
Yeah.
stuff.
Yeah.
But
Yeah.
people get overwhelmed with that attention seeking
Yeah.
and then
Yeah.
break relationship with them.
That's right.
So when they
That's
start
right.
having that issue, they now they're depressed or there are issues and now want to seek help.
That's
That's
right.
one of the things. So these two
Okay.
are common. They're more prevalent in women. We might not meet the disorder criteria, but we might have the trait. But we need to know, why do we have the trait? What happened? Why do I need to always make myself loud? Why do I need to do this? So if we're checking these things, it would help us. I always emphasize it starts with you. We are
Yourself.
always
That's
quick
right.
to point fingers. I'm sure some people are thinking, that's true. That is my neighbor, Yasidi.
Yeah.
He's like, he's always doing
Someone
this.
just said, I know so many people like that.
We're always thinking first of somebody we know like that, somebody we know like that. But really, how are we? When we're able to stand and see, how are we making the people around us feel? Do we make people around us feel uncomfortable? Do we put unnecessary pressure on them? Are people moving away from us because of this or that? Then we watch it and we're able to make life better for people. And
Yeah.
then we're also able to even help our children. Another thing I always emphasize in the videos is that I try to relate it to parenting style.
Yeah.
Remember,
Yeah.
mental
Yeah.
health is not just for us, it's for our
Yes.
children. So the
That's right.
more we know, even if we're going through it, we can help our own children to not grow up to have that dysfunctional
Yeah.
or maladaptive behaviors.
Yeah. Yeah. Totally agree.
So those are the two that I picked out from the
Dramatic.
dramatic group, and
Right.
we can relate, right?
Very dramatic. Very dramatic.
Yeah. So another two. Now I'll go to the fearful
Okay.
and anxious, which is cluster B. We have in this one we have avoidant personality disorders, we have dependent personality disorders, and then we have the obsessive compulsive personality disorders.
Right.
I picked two from here too that it impacts us a lot, and I think we should know more, not just for ourselves but to be able to help other women. And I'll start with the avoidant personality disorders. Avoidant personality disorder is
Okay.
that extreme shyness. In fact, the day we were going to do that in my group, I did not show up at the time that they were expecting me.
Wow.
And everybody was like, what? I did not. Because that way people would
Wow.
not, they won't forget. Just like the way that I
Hmm.
interpreted how our brain is working every time by the drama that I came up with, I did not show up. And in fact, my brothers were calling everybody, calling my husband, where is she? Is she joking? Is it okay? Is it? And that is what happens with avoidant personality disorders. It is different from
Wow.
societal
Wow.
anxiety. People with societal anxiety and they don't want to go, they know that they have this unrealistic, fear and stuff like that. And they're really trying to help, oh my, this. But people with avoidant personality disorder is because of the feeling of inadequacy.
Hmm.
They feel
Wow.
inadequate. They are very sensitive to criticism, and they always almost need like validation from people, so they have this
Hmm.
intense fear of rejection. When I get to this place, I'm not going to
Wow.
do well. When I say this thing, I won't say it well. I'm not even enough to do this. So they
Wow.
stay back and they don't come
Yeah.
out.
Wow. Wow.
And this is
Wow.
affecting them. Remember, personality disorders happen everywhere, not just at
Yeah.
home. So the
Yeah.
people that these people usually have is just maybe their family members. They will not show up for dates.
That's right.
They would miss a romantic date, or they would somebody asking them out or something,
Yeah.
taking them. They
Yeah.
will miss it because they already believe this person would not like them. So
That's
before
right.
you reject them, they are going
They
to
will
reject the
reject
person.
themselves. Wow.
You see, we have
Wow.
a lot of this. When we talked about it, I talk about how it's affecting relationships. These people will not show up for presentation at work because they
Wow.
are afraid that they are inferior. They're afraid that they are unattractive. They're afraid that they are inadequate. So
Mm.
they avoid anything that makes them have, person relationship with people. In fact, there was like a training that I attended, that we had people with this disorder, and when they were talking about it and pouring out their heart, they're talking about how they would not even seek job in a particular place because they are afraid this is the kind of job that will put you out there. And the fear
Wow.
is not that, maybe they are not this. It's just because already within themselves, they have this extreme inferiority.
Mm.
It's happening to
Mm.
women. It's affecting relationship. It's affecting our
Yeah.
careers.
Yeah. Yeah. It will
And
affect productivity.
exactly. So these are the people that they would rather just be a painter in the house, or they would rather just be
Wow.
somewhere, but they would not be out there relating with people. If it's time to go for a party and people avoid them, they will find an excuse not to go with you.
Hmm.
And it is not
Hmm.
because of any, even when you look at them, as I'm dressed now, I mean, I believe this dress is nice. But already I'm thinking that people would see me as, what's this fake thing I'm wearing? Or you are going
Wow.
to, yes. And it is a pattern, and it is affecting them in every way. And if we have
Hmm.
people like this around us, instead of just leaving them, that one will never go out with you, this one will never do this, we can try to help them to find out what is the reason. And
Mm.
again, it comes down to a lot of times we relate it to genetic factors, and it also comes down to parenting style, where
Parenting style.
you talk negatively to a child every time.
Yeah,
Look at
yeah,
you will not even like your mate. Look at
yeah,
Mr. Gloria's wife.
yeah. Comparison.
Look at,
Yeah.
you never see anything good in them. We talk them down. We kill their morale. We say their self-esteem. And for people, a lot of people who do not grow up with their parents, they're experiencing this. So, I mean, Babes Jones is talking about you like solutions. Solution for personality disorder, one, is support from people around them.
Yeah. Yeah.
Support,
Yeah.
to support them, and to also, for those that it can be dangerous when they are in their moods, to also protect yourself. But they need support, and they need to be encouraged to go for therapy.
That's right.
These personality disorders also, some of them have overlapping personality disorders, but a lot of times there are other issues that can bring them for treatment. Like some of them cope with substances. Some of them, they cope with, they are so depressed because of how they're
Wow.
feeling. We can
Wow.
leave the personality disorder and help them seek help for another thing. When they get to a professional, we're able to now see that, okay, maybe this is ongoing. Because remember, they don't see it. They don't see this personality disorder. Even if you're saying it, they don't see it. So the solution is support. First of all, now we're knowing. 2, we support them. And 3, don't focus on the personality disorder or label them. Look for other things around them that you might encourage them to seek help for.
That's
then,
right.
If that one will surface, a trained mental health person will be able to do all this. But let's start with the depression. Right. Let's start with anxiety. Let's start with therapy. Their therapists will do that and help them. So the last one is the dependent personality disorder that I want to go on. This one is the intense fear of being alone.
Wow.
We need to be cared for like a baby. You need to be catered to. They cannot make decisions on their own. And they are so clingy. They are so submissive.
Wow.
Even when they're going through abuse, or even when they're going
All right.
Can you hear me?
Just a minute, please. But I can hear you. There's a call coming in. I'm trying to cut it.
Yeah.
All right. Okay, I can hear you.
So they're so submissive, so clingy. They would never object to anything somebody else says, especially to that person that they are dependent on. They would not object or say anything because of the fear of that person leaving them.
Yeah.
They would not initiate a project or think, there are the types that to pay, we need to pay the bills. You need to tell them to do this. They don't want to pick up the phone and call somebody to come help in the house. They ask you, which shoe should I wear? Is this okay? Are you sure? Do I look good? 50 pounds from their spouses. They're asking, the person they are with. This happens to men too. And then the wife sometimes will say, it's almost like I have a baby in the house. They never make decisions on their own. They are always depending on people to make decisions for them. They will never object to anything people say. They are always extremely submissive. In fact, the person will be their spokesperson, and they're so clingy. They are afraid to leave that person. And then sometimes when one relationship ends, they are quick to jump into another one.
They cannot just be alone. They can't just afford to be alone.
You sound like you know about this. You sound like you
yeah. Well, I guess so. Yeah, I've met one or two people like that. They just cannot be alone.
And it's not because they don't like the last person they had relationship with. It's just that they need someone else to take care of them quickly. And that's how some of us women, we fall into the trap, and you're wondering, why is she not leaving this abusive relationship? Why is she not, can't she be on her own? Can't she be herself? And even when you want to talk or do something, they ask that person to talk for them. They're so afraid. No, don't worry. He didn't mean to do that. I'm fine. We're okay.
Yeah.
No. He bought me something yesterday. And some relationship end now. They're leaving one and they're jumping to another. Like, are you crazy? Won't you even give yourself a break? No, because somebody has to take care of them. And so the thing is, and what we relate to this, a lot of this is also with, sometimes we relate it to parenting style, strict parenting. They make every decision. You can't do this. It's almost like they're doing everything for themselves. Sometimes we find it in, people who were chronically sick when they were young, medical illness. These are the four that I brought out because I think we can relate to it a lot. And in relating to this, I want us to see which of these are we dealing with personally. To some of us that we are behind our keyboards and typing and putting, which of these are we dealing with personally? Then if there are people around us exhibiting this, it's not to label them or to say, now I know what your problem is. It's for you to, one, be able to protect yourself and make sure you're not hard on yourself because of what they're going through. And then three, be able to help them, be able to, kind of, for example, I tell people, just add them to a group where they can learn. When something like this is going on, just tag them. If you make it a thing to tag them on anything beneficial, then they will not really see it as you pointing finger at them.
That's right.
So we really can do a lot to help people around us. And for me to round up, before I take questions, I want to really thank you, Pastor Morin. I want to thank you for doing this. Because like today, we're talking about changing the narratives. I want to tell you, how many thousand people do you have in this group? Your decision to bring me here or not will affect life positively or not. So if we have more leaders, and especially faith-based leaders, organizational leaders, policy makers, and our traditional leaders or cultural leaders or leaders in the family, if we do know more about mental health, the lives of the people around us will just be better. With this thing that I'm doing, I do not leave out children and I'm not leaving out elderly people. Our parents should not be neglected. So when a leader that has foresight, when a leader that is visionary, when a leader is enlightened, imagine the ripple effect. Imagine how many lives will be touched. So I really, really thank you for being one of those leaders that you are helping us. How many people do I know? How many people can I tell anything? But when leaders decide to take action, the effect is so amazing. And that's, I want to end by thanking you.
Thank you so much, Oluwadayo. And to imagine that we just met on a Facebook chat here on BR, and you just commented casually, you came into my DM and we started and I remember I was looking for you. I said, I had this conversation with this lady. Who is this lady? I couldn't remember your name. I came on BR. I said, please, there was a lady that discussed something. And thank God that you saw that message that day and you responded to me inbox. And I'm really happy that we're having this. I remember earlier in the year, just at the beginning of the lockdown, I was telling you, we had a program too that we addressed the general health of a woman. So we brought someone, I remember sharing with you, we brought Dr. Abari, though we had it on Instagram, and she was talking on mental health too as well. And I remember we had Lepasius Boss there sharing with us on social health and how you can manage your social world and how you can draw the line and all of that. I'm very particular about mental health. Honestly, I am. I'm one of those people, like I said at my opening statement, that will be willing to bring people that can talk about these things even on a pulpit on a Sunday morning. I am not one of those people that will say, no, how can you bring this? Let us use faith. There's a place of faith and there's a place of seeking help when you can. And I don't think that, and thank God also, I think that's what drew me to you. The fact that you're a Christian, you know, and you're not doing this just because it's your profession, but there's also the God factor. You know when we spoke over the phone and how you said that was the area God was instructing you and leading you, that actually drew me even to you the more. And I'm really grateful, honestly, Oluwadayo, this that you've done today. I know on a normally day, we're supposed to pay for you to do this. It's your profession, it's your job. And I honestly don't take this for granted at all, And I'm super grateful that you've really opened my mind. I'm going to have to listen to this video again because there are so many things that you've said. I noted it, but I have to listen to it again because to be able to convince those that we're sent to, I also need to have a level of knowledge about what I'm talking and I'm advocating for, you understand? And so thank you for sharing and for not holding back anything. Those 4 things, personality disorders you share that is very particular to women is so true. And with the way you described it is so true. But I think one major thing I'm taking away from this meeting, this conversation, is that look inward first. Start with yourself. For me, that is big deal. Because it's easy to point fingers and say this person, that person, this person. And you said something that the people that have these disorders, they don't even realize it themselves. And so how do you get help? So the first thing is to look inward, check yourself, be honest with yourself, be sincere. I tell people you can deceive every other person, but you cannot deceive yourself and you cannot deceive God. So it's always good to check yourself, find out, why you behave in a certain way and be willing to seek help if you need to. I also love how you explained and differentiated between mental health and mental illness. Mental health is for everyone. We need to take care of our brain. And I really love that you explain that and you let people know that. So when you hear mental health, don't feel like, what to today? I want arrow. I want kidney. What to today? No. But it's just good that we take responsibility for our health. We really need to take responsibility. And let's not hide under grace and hide under faith. I'm talking to believers here. Let's not hide under God will do it. God would do it, but you have a role to play. You have a part to play in doing your own and being responsible as well. I don't know if there's anyone that has questions. Well, I think most people were just enjoying following and I know one thing about our online chat is we usually get more people come on after. So I won't be surprised by tomorrow we would have over 2,000 views, on this particular chat. So I think we've done 1 hour 30 minutes already. Wow, thank you so much, Oluwadayo. Thank you so much.
The freebie that I sent is like a guide that can help you. People can download it and honestly go through that thing to help us and for our family members too. Let's not forget our children, our siblings, and our parents.
Awesome. Thank you so much for this. Babes, I want you guys to know, what's the name of your group again? Mental health.
My mental health matters.
Okay, I can see it. My mental health matters. That's the name of the Facebook group. I already shared it, but I'm going to share it again before the end of today. My mental health matters. And she's right there. I've watched 2 of your videos today, when you were talking about 2 different personality disorders, and you guys will learn a lot. And like she rightly said, one of the ways to support is if you notice someone is going through something, you don't have the information, you don't have the knowledge, as it were, introduce them to where they can get the help. If that's all you can do, come, why don't you join this group? Why don't you join this group? It could help you. You could learn a thing or two. You could reach out to the founder of the group, and just have a chat with her and all that. So it's just always good to seek help when we need, to seek help. Thank you so much, Oluwadayo. I had an amazing time chatting with you and learning and unlearning as well. I had to unlearn some things too about the compulsive something
OCD,
disorder. What is it?
compulsive,
OCD.
yeah.
Yeah, that is different from there's some people that have OCD and it's different from personality disorder. I didn't know that. I thought it was one and the same, but now I know better.
Yes.
And lastly, guys, let's not go out there labeling people. It's the last thing you should do. Don't label people. Some of you have heard some things now. They've said, what was the second disorder you said? The historic disorder that they just love to be
histrionic personality.
right? They are
Yeah.
the seductive, the
Attention
paparazzi,
seeking.
carry me, kind of. So you now be seeing one of your friends that like you now say, that girl has this disorder. No, don't go and be diagnosing people that you don't go and be diagnosing people because of this little thing that you've heard here. No, like she said, there are criteria, that needs to be met before certain people can be, diagnosed. So I don't know if there's any other question. I can't see questions here. I'm just saying thank you, thank you, thank you, thank you. And I believe, how do you join the page? It's easy. It's easy. The name of the group is My Health. Yeah, go ahead. Go ahead.
My mental health matters. Is My Mental Health Matters. I'm going to send the link now again, and it's in the introduction our pastor gave me today. My Mental Health Matters. I'll send the link to it now. And then there's a freebie that I want people to download and answer the questions. You can download it, print it out, give your spouse, give yourself. If there's any trouble in the house and your spouse will think, and it's there, it's not labeling. Like I said, mental health is for everyone. So we need our partners to know about it so they can support us. We need to know about it so we can support them. So download it, give your siblings, or send the link to your siblings, let them download it and just find out where you are. Sometimes seeing us mental health professionals might just be for some clarity, might just be to help you bounce back, might just be for you to learn coping skills. And sometimes you might need medications to use. And just the same way you use anti-hypertensive medications, you use diabetes medications, you might also need medication to help you. And nobody should label us for this. It should be okay for us to seek mental health.
That's right. That's right. Thank you. Someone is asking, can I get your contact here in the US? So, yeah.
Yeah. So join the group or send me a DM.
A DM.
I can give you. Thank you, and thank you for adding me to the US Babes Redefined group where we're there. So if you're also Babes, our information is there. It's a close-knitted group, and we support one another. So just send me a DM, and I would respond.
Yeah. All right. I'm just going through to be sure I didn't miss any question, but no, I'm just saying awesome session, nice session. Thank you. Thank you. Everybody's just saying thank you. And this is me also saying thank you. Thank you, Luadayo. God bless you so much. God bless you and yours. And I pray that this, which the Lord has placed in your hand will prosper in your hand, and your desire and your passion would come to pass. The awareness would increase, and we would change the narrative, here in Nigeria, in Jesus' name. And through you, it will be noised abroad, the things that we need to know and to hear in the name of Jesus. And many lives will be saved from destruction and from, self-destructing as well, as they come to the knowledge of the truth with regards to mental health. Thank you so much, Oluwadayo. God bless you. I can release you now. Thank you. Thank you. Thank you. Thank you. I'll see you in your DM shortly. Thank you.
Okay, bye.
Wow. There you have it, my babes. Wow. Yes, Sister Lushala, it's okay for anyone to seek mental health support. Honestly, I had such an educative session. That's how I'm going to target. It was such an educative session. And to everyone who joined in, thank you. I have no doubt that you learned something. She's going to share the link. I'm going to share the link. I'm going to tag her page on our group. So it's going to be one of those few pages you can access directly. I'm already there. I am going to take the mental status assessment form. I'm going to download it and I'm going to take it too as well. So I encourage everyone. It's free. You know, it's free. Let's start from there. We said we're going to start with ourselves, right? Anyone joining me? We said we're going to start with ourselves. So please let us start with ourselves. Let's download the form. Let's fill it. Be honest. Be sincere. Don't deceive yourself. Don't deceive anybody. Be honest with yourself. Fill the form and let's take it from there. Oluwadayo is an amazing woman. You can reach her on the WhatsApp group, on the Facebook group, My Mental Health Matters. And thank you, Ojo Lakpe, my darling sister. Join me. Let's start with ourselves. Let's check out these things. Let's find out how we're doing mentally. And if we need help, let us seek help. The Lord will help us in Jesus' name. Thank you guys for joining me this evening. I had such a swell time with you all. God bless you. Have an amazing, amazing week. Next week, I have this hot, juicy topic. As in hot, juicy topic. So please don't miss it. Next week, we're going to be discussing something really interesting. Like I said, like clockwork, we're going to be here 6 p.m. on Wednesday next week. Thank you so much. Love you guys. Stay blessed, stay connected, and please stay safe. God bless you. Thank you.